you know something? When any of our healthcare professionals come on, I always ask them, always interested, why did you choose gastroenterology?
I guess with most things, you have an interest and then you have an opportunity, and both of those things happened at pretty much the same time. So I think, first of all, before I became a gastroenterologist, you decide whether you're working with, children's medicine or adult medicine, and that was an easy decision for me. It was from my very first job. I worked in the Children's Hospital in Edinburgh, and then it's just evolved from there. It's so enjoyable. It's such a privilege to be able to work with children and their families that I would never do anything different. In terms of gastroenterology, it asked me a lot of questions.
Yeah.
So I think when I saw patients with different problems and different conditions, I thought, how do we solve that? And I think one of the things with gastroenterology is it's easier than some other specialties to kind of complete a loop. So you see the patient, you do their test, you do their endoscopy, you look at their biopsy samples, you make the diagnosis, and then you move on with treatment. And from a professional point of view, it's quite a satisfactory loop of events.
Yeah.
And, so it started before I was a consultant, worked in England, worked in Scotland, different gastroenterologists, and it all came together really coming back to Edinburgh and doing my PhD with David Wilson, a professor in Edinburgh who set up the service here in the late 90s. He was unfortunate in having me as his first research fellow, so he could have done much better.
Funnily enough, he agrees.
And then Professor Jatsit Sanghi, so he was the gastroenterology professor at the Western General, and he was inspirational really in guiding me towards doing a PhD and really, cementing things 100% within my mind and within my career path.